name is Pranita and today I'll be demonstrating the oxygen administration skills video. For this video, you'll need a simple mask, a nasal cannula, gauze, gloves, and a model head. The first thing that we'll be doing is entering the patient's room and ensuring patient privacy. This will mean closing the door or pulling the curtains. After, we'll perform hand hygiene and introduce ourselves to the patient. Hello, my name is Pranita and I will be your nurse today. Then I will identify the patient's identity using two key identifiers. May you please verify your name and date of birth, in which the patient will respond, name being Stephanie Rodriguez and date of birth being 2/15/1971. And I can confirm the identity using their wristlet that has their information. Once patient identity has been confirmed, I will then explain to the patient what the doctor has ordered and what procedure will be completed. The doctor has ordered for oxygen therapy for you because your oxygen levels have been on the lower end. This oxygen therapy will ensure that your oxygen levels will go back to normal range. Do you have any questions for me? The patient has no questions, so now I will begin to do a respiratory assessment, which will take approximately 2 minutes to do. Once the assessment has been completed, I will then apply my gloves. Once my gloves have been applied, I will get my nasal cannula. I'll take it out of the packaging. This nasal cannula will then be adjusted to the flow meter. And the flow rate for nasal cannulas can be between 1 to 6 liters per minute. If it's between 3 to 4 liters per minute, the humidification will allow for drying of the oral and nasal mucous membranes. For this situation, the doctor has ordered for 2 liters per minute. So the flow rate will be adjusted on the flow meter for 2 liters per minute. And then I will apply the nasal cannula to the patient. I will let them know that this device will go into the nares of the nose and that oxygen will be administered through the nose. I'll carefully place the device into the nares and loop it on the ears of the patient. Once the nasal cannula has been applied, I will adjust it accordingly to the patient so that it's secure and that adequate and efficient amount of oxygen is administered. Once that has been completed, I will be checking on the patient for every 4 hours to ensure that skin integrity is in place. If there's any redness, irritation, or any skin breakdown. To help prevent these, I can apply gauze to the affected areas, such as the sides of the cheek, as well as near the ears, as those are areas that can get irritated quickly as patients use these for longer periods of time. Once the gauze has been secured, again, we'll check for skin integrity every 4 hours. The doctor has been noticing that the patient needs more oxygen, so we'll be now using the simple oxygen mask. For this, I will first need to remove the nasal cannula. I will begin to do so by taking out the gauze. And gently removing the nasal cannula from the patient. The nasal cannula will be disposed. in the appropriate bin. And we will begin by taking out the simple oxygen mask. I will ensure and let the patient know that the doctor has ordered for higher levels of oxygen. Your oxygen levels are still on the lower end, and the doctor has prescribed for you to wear a oxygen mask. The oxygen mask covers up the patient's nose and mouth and ensures for greater oxygen coverage. Simple oxygen masks, the flow rate can go from a range of 6 to 10 liters per minute. I will first attach the end to the flow meter. I'll attach it to the flow meter, and the doctor has ordered for us to administer 6 liters per minute. And I would adjust the flow rate on the flow meter to the prescribed doctor's orders. And then I would apply the mask onto the patient. The mask will go onto the nose and covering the mouth, and the band will go behind the patient's head and around the ears. We'll make sure that the mask is secure, and I will pinch the nose so that it has a better fit for the patient and ensure that a sufficient amount of oxygen enters through the nose and the mouth. Once that has been applied, I will also check for skin integrity every 4 hours to ensure that there's no redness, no irritation, and no skin breakdown. If there is signs, we can always use gauze again and place it on the areas that have the most sensitivity. And this will be your cheeks and around the ears. Those that wear oxygen therapy devices do experience friction and redness to the skin as the oxygen tubings are on for longer periods of time. Once the gauze has been applied, we'll check again every 4 hours to make sure that the patient does not have any skin irritation, redness, or skin breakdown. Now that the oxygen therapy has been completed, the doctor has ordered for discontinuation. I'll let the patient know. The doctor has ordered for you to discontinue your oxygen therapy as your oxygen levels have reached normal ranges. I will begin now to remove the gauze and the mask. I'll remove the mask off the patient, and I will dispose of these supplies in an appropriate manner. Now I will lower the bed to the lowest level and have the call light in reach and ask the patient if they have any questions or concerns. Once that has been completed, I will remove my gloves, dispose of them, perform hand hygiene, ensure patient privacy by closing the curtains and exiting the room. Then I will document the procedure that was performed and any findings that I have found. Thank you so much.